People sometimes say, is my face going to change, or will it somehow be different, and is this result going to be permanent? Without going off track too much, one thing that you should know is we tend to need to have full facial maturity before we operate on somebody. And for people who are assigned female at birth, that generally means somewhere between 16 to 17 years old is the earliest that we would ever potentially undertake doing some sort of transformative facial surgery on somebody. For people who are assigned male at birth, their facial skeleton is still growing until sometimes 18 to 20 years old. And so that doesn't mean that we won't sometimes, depending on what the procedure is, proceed a little bit earlier before full skeletal maturity, but it very much depends on the procedure that we're looking at undertaking. As far as skeletal changes afterwards, there are skeletal changes. This has been studied, but they're not as dramatic as the changes that occur with growth. The changes that occur to the facial skeleton with aging tend to be a little bit more subtle. It's interesting that they tend to occur around the eye sockets and around the what we would call the piriform aperture, or the skeletal perforation that your airways pass through. Most of the changes to a face, for instance, with aging tend to be soft tissue related, or at least the ones that are more outwardly visible to people.